First of all, it's great to be back here at Ecio. It's great to be back in this community with a surprisingly crowded Congress in a very positive way.
For us, it's very good to come back because I think that exchanging with colleagues and with industrial partners will bring us back on the track to push further for our patients.
From my talk, participants can expect to see some of the challenges that we see when we're doing cryoablation, and through some cases that I'll present. Really, I will talk about our learning curve and some of the nuances that we see when we're doing cryoablation, particularly in oncology in children.
The lecture is about combining a local treatment or interventional treatment with systemic treatment. And I think that's the major challenge in colorectal cancer. As we do know, colorectal cancer is a disease which can be very well controlled with local treatment, and systemic treatment is a standard of care. So therefore, how to ideally combine these two approaches and to identify the right patient for one or the other, that's the challenge, and that's what we will be discussing in this session. Ecio has turned to be now a congress which is really integrating clearly the best of the world of local interventional oncology as well as the multi-modal treatment. So the whole wealth of oncology, all of this is to be found here at the Ecio Congress.
My talk will be on the treatment with ablation of bone oligometastatic disease in cancer patients, and I think that what participants can expect from my talk is an insight on how to select the patients and how to deal with the tumor board in order to get patients treated by us. In the session we will cover all the aspects of bone metastatic disease, so from biopsy to bone augmentation and to bone ablation, and how to protect all the sensitive organs, especially nerves that are nearby and should be spared.
In my lecture at the video learning sessions, people will learn how to use cryo in the lung, and the case will be a pediatric population case, and they will learn very practical tricks and tips and how to do the case for real life, and a little bit about, of course, indication and follow-up of patients.
For today's session, we will go for the bone treatment in oncology, and we will cover several aspects of this. First, diagnostic with a biopsy, but also techniques for consolidation with cementoplasty, but also with screw fixation. And then we will move to more tricky procedure close to the spinal canal, and for this I will talk about electrochemotherapy, which is quite new in this field, but also talking about technique to avoid complication with neural monitoring.
My lecture today will feature thermal ablation, and I will endeavor to show how these techniques, such as microwave and radio frequency, can both stimulate the immune system for positive and negative effects. I will also share some of the therapies that can be combined to try to accentuate the positives and eliminate the negatives.
Great to be back, great to be learning, great to exchange, and great to be in Vienna.